Hello, this is Mary Sasresta. My student ID is U3221907 and this is my student ID. Now I'm filming my OSCA video presentation of Part B for this given scenario. This is about 48 years old John Samsil who have been diagnosed with small subdural hematoma, a fracture of right radius and rib and superficial abrasion and bruises following fall, where his left side of head was struck on concrete and he was confused and drowsy following that fall. After John reported of feeling nauseated, I noticed that he has metoclopramide and ondansetron charted. In order to provide education about this medication, I will approach the patient by saying, "Hello John, I'm Marisa. Remember me? I'm nurse looking after you." After introduction, I will check patient's name, date of birth, and MRN number to make sure if it is the right patient, and I'll ask for consent by saying, "We have been chatting about how you have been feeling nauseated, so I have metoclopramide and ondansetron in your medication chart to help you with nausea, and I would like to give you more information about this medication. Is that okay with you?" Once I get consent from patient, I will perform hand hygiene to prevent infection. I will educate John by giving information of metoclopramide, which is used for stomach and esophageal problem. It is commonly used to treat and prevent nausea and vomiting. I will let him know that he might feel restless, drowsy and tired, lack of energy, headache, diarrhea and constipation, and dry mouth. And these are usually expected side effect of metoclopramide. And I also tell him that I will keep on monitoring gastrointestinal assessment and neurological assessment to determine severe adverse drug reaction like confusion, thought of harming self and others, shortness of breath, trouble sleeping and seizure. If you feel any of these side effects, always call for help using bedside buzzer, and any of us will be here promptly to help you. I will educate John that metoclopramide can cause drowsiness, so patients should avoid hazardous activities until stabilized, like lifting, jerking movements, and heavy exercises. And I'll also let him know that if a dose is missed, he should take it as soon as possible, and if the next dose is due within next 3 hours, take a single dose immediately and skip the next one to prevent adverse drug reaction. In oral administration, for better absorption of the medicine, allow 30 minutes to 1 hour before eating and rinse mouth frequently to avoid dry mouth. A large overdose can cause drowsiness and muscle spasm, and in case if you feel any of these, please buzz for help. And I'll also let him know that once the symptom is stabilized, medication can be seized safely. I will tell John about his second medication, that is ondansetron, which is also used to prevent nausea and vomiting. I will also explain that there is a natural hormone in brain called serotonin that may cause nausea and vomiting. So ondansetron works by blocking the action of serotonin. I'll give him heads up about the common side effects like headache, sensation of warmth, dizziness, hiccups, high blood pressure, rapid heart rate, chest pain that he is already having right now, and constipation, dry mouth, and abdominal pain. I'll continuously monitor improvements in GI system, like decrease in nausea and vomiting, and increased appetite, to help document whether the drug therapy is being effective on him or not. I'll be assessing his dizziness and drowsiness that might affect gait, balance, and other functional activities. And I'll give him education that medication is dissolved. When he takes medication is dissolved on top of the tongue. It is not meant to be chewed or swallowed like other tablets. After placing medication on the tongue, allow it to dissolve completely and then swallow it with saliva to increase the efficacy rate of the medication. I will also instruct patient to report bothersome side effects such as severe or prolonged headache, weakness, fatigue, or GI problems like diarrhea, constipation, abdominal pain, and dry mouth. I will let him know that I will monitor fluid and electrolyte status because dry mouth and diarrhea, which may cause fluid and electrolyte imbalance and is a potential adverse effect of drug. And at the end, I will encourage him to have more fluid to restore fluid and electrolyte balance status, and always communicate if he have anything to talk about or if he's not feeling comfortable. Thank you.